what are some different, what will help you to pass your exams? Um, because, exams are not easy. They can be difficult and they can be trying. And I will tell you, but it's always doable because you have to remind yourself that if other people have and are passing their exams, then I can do it too, right? It's just all about actually believing in yourself. That's the biggest issue. And the difference with nursing as opposed to any other field, which is why it's more challenging, is that it's based more on concepts, not necessarily um what's the word I'm looking for? It's like it's not word literal or linear, right? So when you, for example, if you're studying math, math is 1 plus 1 equals 2, 2 plus 2 equals 4. So it's a very obvious conclusion to the answer, right? Based on very simple principles. But nursing is a little bit more challenging because you have to first understand different concepts. And then once you understand those different concepts, then you have to put the picture together and apply it to the real world setting when it comes to different exams. So I'm going to give you some different strategies that you can implement, do that will help you moving forward so you can better understand like how to prepare. So one of the biggest issues, let me kind of fast forward a little bit. One of the biggest issues is not having a good foundation to begin with. And I will say it's not your fault, because it's hard to know what a good foundation looks like if you have not really been exposed to that, you know? So one of the things that I see for a lot of people is that, the education that they went through, the program didn't really prepare them for the real world setting or for nursing school or to take the NCLEX, I should say, and, or different type of exams. And so there's a challenge with really comprehending. So one of the things you want to first prioritize is you need to know the 11 body systems. Okay? That's the foundation to passing so many different nursing exams. And when you're in nursing school, different exams, med surg, patho, in your courses, when you are taking the RN exam, when you're taking the LPN exam, when you're taking the NACE exam, all the tests that I mentioned yesterday as well, the ATI exam, the HESI exit exam, your first thing that you should definitely understand at minimum is how each of the body systems works. Like that should be the first thing that you should have a general understanding of. So for example, there's 11 body systems, from the cardiac all the way to respiratory. So we have the cardiovascular system, the digestive system, which by the way is also called the excretory system, the endocrine system, the integumentary system, which is also called the exocrine system, the lymphatic system, the immune system, the muscular system, the nervous system, the urinary system, the reproductive system, the skeletal system, and the respiratory system. Okay, so what you should know is you should know how they each work. Because if you don't understand how they each work, you're going to struggle with understanding the disorders. You're going to struggle with who do you see first. You're going to struggle with grasping the bigger picture or the nursing process. So at minimum, you got to make sure that you understand each of these systems. So one, you need to know the normal physiological processes in each system, all right? So know what they are, what's the normal physiological process for each of the system. And I'll give you an example as well. Two, you need to understand the appropriate lab values. Three, you should understand the organs involved. And then this is extra, then you want to know the disease processes and how it affects that system. Okay, so let me give you an example with cardiac system, right? The area that a lot of people struggle with. At minimum, you should memorize and understand how blood flow works. Okay? At minimum, you should know how blood flow works, because if you understand how blood flow works, then you understand then so many other things will make a lot of sense. Like everything from left-sided heart failure to right-sided heart failure, all the way to maternity health, understanding what's happening in the uterus when the baby's in the womb, understanding all the different shunts, understanding just so many different things. So blood flow is all about, and there's a video where I talk about this on YouTube, but blood flow is all about understanding how does blood enter into the heart, right? And then how does it leave the heart, right? And so simply, if you can understand the flow, the normal flow, then like I said, it will make a lot more sense when you're looking at diseases. And then you need to understand labs. So you should know by heart, you should know different types of lab values. Like at minimum, the labs that you should know by heart, if we're looking at CBC and chemistry panel. So CBC stands for complete blood count. So at minimum with the CBC, you should know WC labs, like for example, white blood cell count, H&H, right? What's the normal range for each of those? And then not just know the normal ranges, but also understand, okay, what does it mean if that lab value is low? And what does it mean if that lab value is high? And then what do you do about it? And then the next best thing would be what triggers that lab value to be high and what triggers that lab value to be low. That would be the next best thing. So, sorry, y'all, this is in my eye. I don't know what it is. So that's what it is that knowing those lab values and then knowing the organs that is involved with each of those systems. Okay, so for example, the cardiovascular system, the organs involved are the heart, the heart, obviously, the arteries, the veins, the vessel that runs all throughout the body. Those are the main organs involved. So this is, I showed you an example. I wrote it out, and I'm saying it out loud too. But like I mentioned, blood flow of the heart, where does blood enter into the body? Systemic pressure, so the preload and afterload. These are 3 examples. Each of them are individual, but you should be aware of what they are. Preload and afterload. The third one is pulmonary circulation. So how does blood flow through the lungs, right? How does blood flow through the lungs? When you understand the normal processes, it will help you to understand the implications of the disease, and then also what signs and symptoms you can anticipate. So what people do wrong is that too many people, they try to memorize the signs and symptoms, and they often forget what they are because they're either forgetting what they are or they're confusing it with something else. So because they're confusing it with something else, they don't really understand the picture. So instead, your goal is to understand how does it work. If you understand how it all works, then you can be able to anticipate what happens next. Then you can anticipate what symptoms you would see, right? So for example, if I have a patient and let's say there's a problem with the way that blood flows from the right atrium to the right ventricle to the lungs, and there's an issue with the blood not being completely perfused in the lungs. So if that's the case, then I know that this patient's going to have a problem with tissue perfusion. This patient's going to have a problem with shortness of breath. They're going to have issues with difficulty breathing because the processes that do all those functions are not working. So that's an example of that. When you get that picture, it makes more sense. And sometimes, honestly, you may have to listen to things like this over and over and over again until it clicks. Because I remember for me when I was, first getting a hold of this, it took forever. Like I had to listen to it multiple times, read it multiple times before it really like made a lot of sense. Okay. So another thing is so now let's say you're learning the like details of disease. So the issue for some of you, the reason why you are struggling with the diseases, right? Because the people tell me that's often the area that they struggle with the most when it comes to taking different type of tests, especially their NCLEX tests, is you're not learning all the right details. Okay, you're not learning all the right details of the disease process. So what that means is there's 4 different things that I recommend. The first one is you need to know the pathophysiology. Now, one thing I have realized, unfortunately, is that it varies from person to person because it varies based on your education. But a lot of people that told me that they went through either asynchronous programs or self-taught programs or accelerated programs, the part that they don't teach you is patho. That's because technically, because the reason why they fast forward the patho part, when you do these different programs, they'll focus on like med-surg 1, med-surg 2, so like they'll expect you to learn med-surg and etc., diseases and etc., but then you don't know anything about patho. And so now if I ask you, okay, tell me the difference between type 1 and type 2 diabetes. Tell me the difference. Because I noticed this, even when I talk to certain students that struggle in the past, I'll ask those type of questions. Okay, tell me what type 1 is and tell me what type 2 is. Like I'll put a question on the screen and then they'll pick the answer incorrect. And then I'll ask, okay, what do you understand type 1 is? And what do you understand type 2 is? And they may say something to the effect of, oh, type 1 is juvenile, or type 1 occurs when they're younger. And then they'll say, okay, type 2 is adult, so it happens when they're older and they have really high blood sugar. Well, the problem with that answer is that has nothing to do with the pathophysiology. That answer is only describing, in general, what type 1 and what diabetes is. Oopsie, sorry about that, y'all. It's only describing what diabetes is. It's not describing the difference. So if it was a better answer would be, okay, type 1 is where the patient has an issue with their beta cells. So essentially the pancreas, all right, let me show my face on here. So essentially the problem is that the pancreas, the beta cells in the pancreas are damaged and destroyed with type 1. Usually it occurs when they're born. It's congenital, it's juvenile, so it's younger. So the beta cells in the pancreas are destroyed. And that's important because the beta cells are responsible for secreting insulin. So because it cannot secrete insulin, that's why the blood sugar is so high. So that's why type 1 is type 1. But then with type 2, the issue with type 2 diabetes is that these patients, they have insulin resistance instead. So their pancreas is fine. Their problem now, though, is that they have insulin that's being released, but the insulin is not grabbing the glucose enough in order to lower the blood sugar. So that's why their blood sugar is high. And that's why with type 1, you have ketones or ketone acidosis, but type 2, you don't. See the difference? So which type of, based on what I just said right now, which example do you think you're going to be more likely to see on your exam? The second one. Which one do you think you're going to be more tested on? The second one. So you have to know patho, and you can't prioritize patho. Can you repeat the difference? Okay, give me 1 second. I'll repeat the difference for you. You can't, when it comes to patho, you have to know the difference. If you don't know what it is, then it's going to be hard for you to know who to see first, what to do next, and etc. All the additional things that follows afterwards is hard. And so so sometimes these nursing programs are doing you a disservice when they don't teach you pathophysiology, because you may put in so much energy and effort to do a bunch of questions and go over signs and symptoms. But if you don't really understand the bigger picture, it's not going to make sense. So one more time, type 1 versus type 2. So, and this is why you have to also understand the digestive system. Okay. So the pancreas, it's involved in 2 different systems. The first system it works in is the digestive system, and the second system it works in is the endocrine system. So it's a part of 2 different systems, okay? So in the digestive system, the pancreas contains tiny cells called beta cells. Those beta cells are responsible for releasing insulin. Okay, because one of the functions of the pancreas is to release digestive enzymes, right? In addition to insulin, but specifically the beta cells in the pancreas releases insulin. With type 1, though, the beta cells are damaged or destroyed, and because it's damaged or destroyed, it can't release that insulin, and that's why the sugar is so high. But with type 2, though, type 2, they have an issue where they have what you call insulin resistance. And what that means essentially is that the insulin that the body is releasing is resisting the glucose. So essentially it's not grabbing, and I'm just using simpler words than medical terminology, but it's not grabbing all the insulin in order to lower the sugar. So that's as a result, meaning that they're resisting. These are receptor sites, and they're not grabbing hold of the glucose, I should say, the insulin, and that's why the sugar is so high. Okay. Signs. So the first thing is that for all diseases, prioritize patho. Second thing, number 2, is signs and symptoms. So now that you understand the patho, then now you can focus on the signs and symptoms, and now it becomes obvious. There's a reason why you can say, okay, why this disease has this signs and symptoms versus this one does not, even though they're similar, because you understand how the patho works. Okay, so for example, a patient that has gastritis and a patient that has diverticulosis. Gastritis and diverticulosis, those are both problems involving the GI system. Those are both issues where there's something going on with the stomach, okay? But the problem though is that with gastritis, it's the lining of the stomach that's inflamed. But with, what's the other one? The diverticulosis, there's an issue with pouches in the stomach. So with gastritis, they're gonna complain more of like a gnawing feeling in their stomach. But with diverticulosis, they're gonna complain of feeling like a discomfort, like a pain, more like pain when they eat certain types of foods. So when you understand how it actually works in the body, like on a microscopic basis, then the symptoms makes more sense. And then you'll understand how to treat it better and who to see first. And then finally, you have the risk factors. So the risk factors are going to be essentially, okay, what would put them at risk for having X, Y, and Z disease process? And then the last thing is treatment, right? What's the best way how do we treat this issue, or how do we treat this illness? And essentially the way that we treat it is going to be either pharmacologically or non-pharmacologically, right? So, or surgical. So is it that so what drugs do they take? Are there specific nursing interventions that we do? These are some examples of different type of things that we'll do in order to treat whatever the issue is. And some things are only just treatment, they're not cures, right? Some things are only just a form of treatment, not necessarily a form of a cure. Okay, so that's the example going forward. Okay, that's an example going forward as far as like going through, sorry, let me pass over all this. Going through when it comes to different types of learn like diseases. Then let me talk about strategies when it comes to questions, right? So here's what I'll tell you. It's hard to think critically with a poor foundation, all right? It's hard to think critically if you don't have a strong foundation. So meaning that if you don't really understand, um, so what I'm looking for, if you don't really understand, like I said, the fundamentals. So here's a quick question I put on the screen. It says, the nurse is teaching the client with angina about common expected side effects of nitroglycerin. The side effects may include which of the following? A, high blood pressure, B, stomach cramps, C, headache, or D, shortness of breath. So another secret to passing the exam or passing your exams is honestly learning more strategies, right? So, and I think I may need to clarify what strategy means, because I think sometimes people may not have the same understanding. So when I say the word strategy, as far as like exams and tests, I'm talking about a strategic way of breaking down a question or analyzing something. Okay? A strategic way of breaking down a question or analyzing something. So for example, a lot of times people tell me their biggest challenge is like SATA questions. They feel so overwhelmed with SATA. And honestly, if SATA is a challenge, then there's usually an issue with the way that you're critically thinking, and also with how you understand the diseases. So you have to focus on also learning strategies for SATA questions, strategies for priority questions, strategies for drugs, strategies for question analysis. Learning multiple strategies will help you to better answer questions. In the past few days, like in the past week, I've gotten like several people that emailed me and told me they passed their NCLEX using like all of pretty much the teachings where I went over strategies. And they said how one of the things that helped them the most was just learning how to answer the questions better and how to like, apply the strategies. So for example, one thing that you want to pay attention to when you're studying is, as far as pharm, is the side effects. Okay, so I would suggest you can do it multiple ways. You can either get a piece of paper, or you can get some flashcards, or you can get a notebook and you put on one side the drug, and then on the other side or the other half, the side effects. You should know at least 2 side effects and 1 adverse effect. All right, 2 side effects and 1 adverse effect of the most common drugs. There's no way you're going to know every single side effect, right? Or every single drug. It's not possible, right? Unless you are, trying to become a doctor or something. But at minimum, you should learn the side effects of the drugs that we as nurses give often. So for example, drugs for blood pressure, drugs for heart disease, right? Drugs for diabetes. We give those drugs all the time. So those are the ones you should know. So know at least 2 side effects, and then also know 1 adverse effect. And then you need to understand the difference between a side effect and adverse effect. They're very different. It's not the same. A side effect is something that is expected, but we don't necessarily stop giving the drug. But adverse effect means that there's a high mortality risk, and you need to tell the doctor immediately and they just stop taking it. That's what it essentially means. And then another strategy is honestly to just learn more keywords. So if you can recognize different type of keywords, man, you'll do better and better. So learning more keywords as well is really important. Knowing different keywords and being able to interpret what they mean, that also makes a difference with your ability to pass your exams. So for this question on the screen, once again, it says the nurse is teaching the client with angina about common side effects of nitroglycerin. The side effect may include which of the following: A, high blood pressure; B, stomach cramps; C, headache; D, shortness of breath. So this one, the answer actually is going to be, oh, I'm sorry, I forgot one more thing. So one thing that I do is I highlighted in bold and red the keywords, like I was talking about earlier, is to pay attention to those keywords. So the correct answer is going to be C, the headache. So if you understand how the drug works, nitroglycerin, it's what you call a vasodilator. So there's multiple drugs that can produce the same outcome, but they have a different way of working, right? So I'll say it one more time. There's several drugs that produce the same outcome, but have a different mechanism. And because they have a different mechanism, that's why they have different side effects. So for example, nitroglycerin, it helps with mainly chest pain. So we usually give it to patients that's experiencing chest pain. That's the number one reason why we give it. And it's a vasodilator. What vasodilators do is that they relax the vessels. So when somebody is having chest pain, they're having vasoconstriction. So a nitro, it helps to relax the vessels. So that's going to produce the side effects: headache, hypotension, and dizziness. Okay, that's essentially like what you need to understand, is like knowing those side effects and knowing that adverse effect. If this was a different answer, then like for example, an adverse effect, then there would be a different response. So just a quick recap. One, in order to do well in your exams, you need to first know more of the diseases, okay? You need to first understand how each of the body systems. Two, after you know the body systems, you need to understand how the diseases work. So you need to be familiar with each of the four different, or I should say the three different elements, which is pathophysiology, signs and symptoms, and then risk factors, and then treatment. Four. So the biggest issue that stops a lot of people is that they don't understand patho. And the problem is that they weren't exposed to patho a lot of program in their educational program. And patho is like the cement. It's the glue that helps to give you the bigger picture. You got to know your patho. The other issue too is, or the other thing as well is, when you understand patho, then you're able to differentiate one disease over another disease, even if they're similar. And when you see it on tests or you see it on different type of exams, your ability to differentiate between one or the other influences how well you do on the test. It influences how you answer the question. And then the last thing was pharmacology. When it comes to pharm, in order to do well with pharm, first you want to prioritize, obviously knowing the drugs, prioritize the medications that's most frequently seen on the exam. And those are going to be the drugs that the nurse usually gives, like the drug, because they're based on disease processes that's common, like diabetes, high blood pressure, COPD. Those drugs you should know at minimum. And you should study at least 2 side effects and 1 adverse effect. Side effects and adverse effects are different. A side effect has to do with something that you would anticipate, but doesn't necessarily mean that we have to stop giving it. So it doesn't require you to intervene and tell the doctor necessarily. But adverse effect is life-threatening. And that means that's something where you would stop it immediately and you would tell the physician. And then the last thing I mentioned is that to focus more on strategies and learning strategies, period. So if you can get flashcards, or if you use like a notebook, and let's say, for example, you grab a notebook and on one side you put like the drug name, right? And on the other side, you list out the side effect. It's super important because for both your exams, pharmacology is one of the highest covered topic. And pharmacology or medication, med errors is the #3 leading cause of death in the United States. So I best believe, especially when the next gen NCLEX come out, for those taking the next gen test, pharm will definitely be a big priority on the test. So you do want to make that a priority as far as when it comes to learning. Okay. So I hope that this was helpful. I hope that you learned something. I will send out the replay via email after this is over so that you have a chance to go back and watch it. And then make sure that you come back tomorrow. So tomorrow will be day 3. It's going to be a different topic. Let me pull up and see. And we're not going to meet through the Zoom. Instead, tomorrow I'm probably going to do as well via Instagram and YouTube. So today was different because I really wanted you guys to be able to, see the presentation. And I realized it'd be easier just to make things visual. So for the 3rd day, we're going to be talking about, let me pull it down here. How to pay for your nursing education. So if you are either getting your associates, your bachelor's, or your master's, I'll give you some different ideas, different steps, different things you can do that will help you to pay for your education so you can end in the least amount of debt. All right, so that was it. Thank you for watching. If you have any questions, just send me an email. You can apply back to the email where I sent this link, and I'll talk with you guys very soon. All right, take care.